welcome to Farm Here Daily, a Field Forward podcast. I'm your host, David Geiger. Today on Farm Here Daily, it is tough to find a good health plan on the farm. We cover those challenges as well as opportunities of the Landus Health Program with Jeanie Cunningham of Affinity Health. Please be sure to like and follow the podcast as well as our social media at Field Forward Pod. We would love to have you join our community, keeping folks informed about what is affecting our farmers. This is Farm Here Daily. And joining me on Farm Here Daily, we have Jeanie Cunningham with Affinity Health, and we're going to go over the Landus Health Program, continuing to promote health and wellness among our farmers. Jeanie, thank you so much for joining us on Farm Here Daily. And let's just start off with, I guess, the elephant in the room, and that is farmers oftentimes have difficulties getting access to good health care, especially if they face difficult situations. Can you describe the Landus Health Program and the work you guys do?
So thanks for having me today, and good morning, everyone. My name is Jeanie Cunningham, and I've worked with the farmers and the ag space for about 5 or 6 years. And what we've tried to do is create a program, a health plan that will serve your community. The challenges for the farmers, and the biggest challenge is their group size. They have limited options for health insurance, health plans, because the majority of them have less than 50 employee lives, some of them down to one and two. So, what we've done is we built a program that will provide them with a major medical product, includes all the bells and whistles that you get with a Blue Cross plan or a United Health Care plan. And we've set that up so that they can purchase that on an individual employer sponsored basis. All that's words on the page, but bottom line, what we've tried to do is build something that'll be beneficial to them. In a lot of cases, they're out there buying healthcare.gov. They're buying things that are um, different and unique because of their lack of choices. The goal for me is to let everyone know they have another choice, is to let all the farmers out there, their families, their small group, if you will, know that we have something that will work for them, that's really going to provide them with good coverage. I will share that we do now offer ancillary coverage down to one employee life through MetLife. We offer vision, dental, and life insurance. So we're pretty excited about that. It took us a minute to gather that up and get that going. Actually, about 3 years, but it's a great product, and I seem to have lots and lots of farm folks that are using it and enjoy it.
Having choice, definitely a massive benefit. Why, still at the end of the day, do farmers need this? Why would they need to have this type of risk management tool when it comes to their own health?
Well, for me, I believe that everyone needs some type of health coverage, particularly farmers. They're out there every day. They're working outside. They run into a lot of areas where they could actually need this type of coverage: accidents, illnesses, chronic stuff that happens to farmers. And what they're going to get out of this plan is that type of coverage, that full coverage, the inpatient, outpatient services, pharmacy benefits, all of it is included in our plans.
Now, this might be a bit of a trail away, but I know there tends to be the common stereotype or joke of a farmer going into the doctor's office, into the emergency room area, and the doctor's being like, "A farmer's here. He needs to go to the front of the line because it must be
Absolutely.
bad," right?
Well, yeah, because under normal circumstances, he's just not even going to go unless he's really bleeding. I'm not sure how down in the weeds you guys want to get on this, but farmers are notorious for not even going unless it's something really serious. So again, if he's there, he needs to be popped up to the front of the line. He'll have emergency services on our plan. Like I said, any kind of inpatient and outpatient services are also going to be available as well.
Still, the reason why I bring that up is because we know farmers are hesitant to go themselves. That just it, like I said, stereotype. But this is more than just the farmer themselves because oftentimes they're taking more care of more than just themselves. Is that
Hmm.
right?
That's right. What we do is we'll offer after we've completed the rating process, the quoting process, then we're going to offer you what's called composite rates. Composite rates are four-tier rates. It means you'll have an employee rate. So if you are a farmer that has employees, you'll have that available for them. It'll have an employee spouse rate, so you can cover your spouse. It'll have an employee children or child rate, which means that if you just have children, you can cover them as well. And then it'll have a total family rate. So our goal is to help you to include your dependents, all your family members, if you need to, on the plan.
We know health insurance is a hotly debated topic, and there are many opinions that fly around. You mentioned earlier choice is a big part of this. Beyond even just a farmer saying, hey, I want to try out this Landus Health Program, is this something that also just creates competition to allow for more or better competitive rates in other markets as well, just by the sole process of having this one more option?
The again, the challenge is the group size. And for me, what I found is I have only a couple of options if you have one or two employee lives. And most of those options are going to be higher than what I have to offer. Our plan and our rate system is based on medical underwriting. So when I provide you with your quotes, your rates, it's going to be based on information you provided for me. That includes gender, birthday, and then any health conditions within the group of people that we're trying to insure. So, right out of the gate, if you will, I'm going to be able to um, most likely beat your community rated plans. A community rated plan is how the rates are produced on an Affordable Care Act plan or a healthcare.gov plan. And this may be more information than anybody cares about. So stop me if I get going.
No, I'm
Um,
I'm happy. We're diving into the weeds
yeah.
today. We're talking
So
about this. Yeah.
so that those rates are always based on gender and birthday only. So they're going to automatically be 10 to 15% higher than my rates the majority of the time. Now, if somebody in your group just had a triple bypass last month, I'm not going to be competitive for you. But these are all conversations that we have right up front so that you don't do any of the due diligence or put in the effort if we already know that, if that makes sense.
It does. Another way I wanted to talk about this is because, the health and kind of going off of what you just said there, the health insurance market and the health industry is extremely expensive.
Mm.
Is this something then how does it stay at a competitive rate? Is it mainly because dependent on that group, or is there plans or subsidies that are involved that allow farmers through the Landis Health Program, I guess, operate in a way that is easier than trying to just get a small business insurance plan?
So the biggest advantage that we have is, again, down in the weeds a little bit, we are a captive. We have all of you folks in this large group, if you will. You still have your own plan. Don't misunderstand, and you have your own billing. You're your own group. But when you go out and you purchase reinsurance or a stop loss insurance for a group like this, the more belly buttons or lives that you have, the better your rates are going to be. So our goal and is and has been, we have, gosh, probably 600 farm lives in this program, with about 18,000 lives in the total triad benefits program. Which what that means is, again, the more we have, the better rating systems we're going to get back for things like administrative services, things like stop loss. We purchased the nationwide network, which is called Cigna. Um, and we get lots of great discounts because of the number of people. So is that kind of an answer to your question? Is that helpful?
Absolutely, absolutely.
Okay.
When you go through a program like this, are you able to avoid some of the headaches that are involved with trying to just, I don't know, when you have your typical insurance plan, you have to go through layer after layer, and sometimes you get denied, sometimes you have all these processes, especially for problems that are pretty immediate or your doctors recommend. Is this helpful, or are there intermediaries that support farmers through those
Well,
processes?
I don't want to. I want to be completely transparent, and we do have some hoops that we ask folks to jump through. Just like United Healthcare comes to mind because they have tons of them. We don't have as many as they do, but we do have things that you have to do. One of the good news pieces to our program, though, that seems to be really popular and has kept me basically in business for all these years is we give you hands-on personal service. So at your farm, your company, whoever you are, you would be assigned a personal account manager that you could actually call. This is a real person, not buttons to press. And that person is going to help walk you through. So if you have something that you're diagnosed with, you don't know how it's covered, you want to know up front. I'm one of those people that I need to know everything in advance. I don't want to be surprised. So if you have those questions, you can call your account manager. You can get those answers and at least know what you're going to have to do before you have to do it. So that's the best I can give you on
It
that, sir.
it is better though. I mean, the crux of the question is AI isn't going to just deny your claim immediately.
No,
You're not going to have
no,
to press one,
no,
two, three, say your name 5 times on the
no.
phone before you finally even get a ring to a person, and then they're like, "Well, you're not in the right spot," so you have
Right.
to do it all
We
again
don't
to
do
find
that.
someone
We
else.
we absolutely do not do that, sir.
Okay.
And it's certainly been like I said, I was really surprised when I first started working with the in the ag space at how happy people were to have someone to talk to. I guess I just didn't realize that they never had that type of service before. So
It is very much a rural priority, I think. You have your local dealer for your input costs, your seeds, your equipment, and that's just very important to folks, and I can see
mhm.
that being extremely valuable. And along those lines, because you are working with folks in rural America, that might mean too there would be some hospitals or locations that might be outside your normal scope of typical insurance health approved providers. Is there any difficulties in getting local hospitals, local emergency services, local doctors on this plan?
So, what we do as far as our network, like I said, we use Cigna. Cigna is one of the largest nationwide networks, and I actually placed this business, this plan in 48 states, still missing two, but that's okay. Um, and and we use Cigna because they're like 98% coverage for the physicians and the hospitals. One of the things that I make sure to let everybody know is if you have a deal breaker, if you have a specialist you're going to need a hospital, all you have to do is ask. We're not going to ask you to pull the trigger or commit to anything without confirming what you need. My goal isn't to plug you into this plan. My goal is simply to um, provide you with an opportunity to have a good plan and continue to go to the people that you want to go to. So we'll look that up for you. There's also a place on the website where you can look up anyone that you want. We have out of network benefits as well. They just don't pay as well. So you can certainly go out of network. Something to keep in mind, which most everybody knows these days, if you have an emergency, you're not going to be limited to an in-network provider. You go wherever you need to go, and it's going to be paid as in-network services.
Jeannie, when you engage with farmers, when you talk about the Landus Health Program and the other work that you do around this subject, What tends to be the number one question you get if we haven't already covered it from farmers specifically?
The number one question is always going to be about the plans, and they want to know what type of plans we have. So we offer a range of plans, a range of deductibles, a range of out-of-pocket maximums, if you will. That's what all farmers are looking for. They want to know what's it going to cost me if I have an accident out in the field or if I have a major issue, illness. And, the annual stop loss, the annual out-of-pocket max is their big question. We rate for all four of those plans once you've submitted your information, which we do on a secure electronic site. And once I bring those plans back in, I describe those plans, how they're going to work, show you the composite rates, and then you select the one that you want. But that's their biggest burning question. How much is it going to cost me annually? And then how much is it going to cost me premium and rate wise?
Jeanie Cunningham is with Affinity Health and of the Landus Health Program. Jeanie, thank you so much for your time and availability to talk about important wellness issues for farmers here on Farm Here Daily.
It's been my pleasure. I really appreciate it. And if anyone needs anything, all you got to do is give me a call.
What would that number be, by the way?
660-525-0274.
And while we're on the topic, would you mind sharing the website farmers could go to? You mentioned that as well.
So I don't mind sharing that. And I had that up here. So it's going to, you can just type in Landus Health, but it is landus.ag/Landus Health. It's real easy. And honestly, you can dig into that website, you guys, and get a lot of this information. You can look at the plans. You can't look at rates, but you can get started on that rate process. Remember, we're available the first of the month all year long. So if you want to start your plan on April 1st, if you want to start it June, you've lost coverage with your spouse's plan, you can start our plan anytime. We don't have the open enrollment restrictions. We're going to lock your rates in for 12 months. And, I hate to brag, but I'm going to tell you, I have about a 96% retention rate for this plan because once I get you, I try real hard to keep you. Okay?
This is Farm Your Daily, a Field Forward podcast. Thank you so much for listening. Again, in order to continue to produce this type of local content, we would love to have you join our community. So please follow the podcast as well as our social media channels at Field Forward Pod. You can also find me on social media at Geiger Reports. Again, I am your host, David Geiger, and I'll be back again tomorrow, everybody.